Hello everyone, welcome to Let's Learn episode 2. Today we are with dentist Hatice.
How are you, Dr. Hatice?
I'm doing great, thank you. How are you?
We are also great. So today we will ask you some questions about dental treatments. Are you ready?
Of course, bring it on.
Okay, the first question is, which disease need attention? Which disease cause problems for dental treatments?
Okay, there are a lot of diseases that can cause problems for overall health and of course oral health. For example, diabetes, hypertension. We should take precautions when we do treatments.
Really? How?
Yeah. For example, if someone has like bleeding problems, we should take care of it before we do implant treatment, any treatment that causes bleeding. For example, if someone has diabetes, this causes wound healing to be decreased. That's why we need to take precautions.
Okay, is there anything we should do about pre-arrival?
It depends on the treatment. If someone came for implant treatment, then they need to quit smoking and decrease alcohol consuming, that kind of stuff.
How do you convince the patient when they insist on the dental treatment which is not appropriate for them?
Okay, that's a hard subject because sometimes patients see something on Instagram, see something on celebrities and they want the same smile. But it differs because not everyone has the same face shape, not everyone has the same smile, so not everyone has the same treatment plan. So we have to explain the patient the treatment plan that's appropriate for them. So it depends on you.
Okay, but how do you decide the best treatment for our guests?
Okay, first we take an X-ray and I examine you and I tell you about treatment options, what's best for you, what's ideal for you. Then we can discuss together what's your wishes, what you dream of. Then we can decide together.
When you meet a person, do you firstly look at their teeth and think what can be done for them?
Oh, I do it all the time. It's actually kind of bad.
So when we talk, do you look at my teeth?
Always. First your teeth. Because when I talk with patients, because I always see the teeth, I think myself we should do this, or I think she has gingivitis, I think we should do this. So it's kind of bad for me, but I'm getting better with it.
So it's always in your mind?
Always. For example, I'm laughing with my friends, and when they laugh big, I saw, oh, can I see? I think you have a decay. So I get a spoon and look in the middle of the meeting. So it's a mess, but I'm working on it.
Can you tell us about a funny or strange moment that happened to you in your working life?
Oh, I have a lot of weird and funny stuff.
Tell us everything.
Okay, one of my patients, it's back in the day, I was working, and one of my patients was so nervous. She needed a filling to do. She was so nervous, I made her relax and we did the anesthesia, and I start doing the filling. So I look at her, her eyes are closed. So I call her name, are you okay, are you okay? At that moment I thought she totally fainted. So I poke her, are you okay? No response.
Maybe she was sleeping.
At the 10 seconds I thought okay, she's dead, what should I do? So I literally shake her, then she starts snoring and is it done? So I say, no, it's not done, but you can go to sleep. But at that 10 seconds, I thought should I call the police? Is she dead? What should I do? Am I in jail?
That's really funny. They are afraid and then sleeping.
Yeah.
Okay, this question comes a lot to me. So some patients are asking if the cigarette smoke and alcohol is good for tooth pain. Is this true or just a myth?
Okay, I don't know who came up with this, because I think that a smoker or maybe alcoholic person came up with this, because that's just a myth. No smoking, no alcohol consuming is not good for your overall health and not good for your teeth at all.
Okay.
That's just lies.
Okay, thank you. Okay, this is going to be a weird question, but not too much, but some of the patients came up with this question. So, is it possible to make fangs? Does it harm the teeth anatomically?
Okay, I don't know who wants that, but I'm not judging. If someone wants that, I explain what can we do and what's the pros and what's the con of this treatment, because it's anatomically not correct. Your teeth shouldn't have, except your canines, you shouldn't have pointy things. But if patient really wants it and accept the consequences, we can do it.
Okay, so I can say them that yes, we can do it, but you can have
Yes.
these problems.
Like, I don't suggest it. I don't encourage you to do it. But if you really want it, we can do it. But I should explain you like why you shouldn't have it, what can be the problems. For example, it can change your bite, so you can have jaw problems, jaw pain. But if you're okay with these problems, so we can do it.
Okay.
Okay, I'm wondering what is your daily routine as a dentist? We always see you with our guests, but can you summarize how is your day going?
Okay, it depends on the day, but mostly I wake up at like 7:30, and if I have time and motivation, I do like breakfast. If I don't have time or I don't want to wake up, if I'm lazy that day, I just grab a coffee and go to work. I look at the charts, look at our patients, what they need, how many patients we have. Then I took my first patient, we take an x-ray, we do the treatment planning, we do if she needs like root canal treatments, Hollywood smile, implants, we do that. Then I eat lunch, then I go back to work again. So it's
Always
like that.
busy, right?
Always working. Everyone's like, I called you, but I couldn't reach you, so I'm just working.
Okay, I have an important question. This is really an important issue because I have so many questions from the patients. They are asking about the implant treatments. Can we do it at once that I don't have to come again? Is it possible?
Okay, implant is a like complex issue because it's kind of a surgery. So we need first patient come, we examine, we check the bone level, we see what she needs. Then we put the implants, but we have to wait until the bone fuses with the implant. So we can't do crowns immediately. That's why we need the second visit.
So there are some types of implants that we can place and directly install the crown on it. Is it healthy? Do you advise this treatment?
Yeah, there are some implant brands that say like we do this, we suggest this. But in my experience, I like suggest to do second visit, so it's not I don't want to take the risk because if we put it immediately, there's a risk of implant to fail. That's why I don't suggest it. But if patient wants to come once and don't have time or wanna take that risk, of course we can do it, but I don't suggest it.
Okay, thank you. Okay, my last question. If I chew gum every day, can I prevent gum disease?
So gum disease can mean a lot of things. You can have red gums, swollen gums, your gums can bleed. So in order to solve this problem, you should take good care of your teeth. You should brush properly, floss properly, and do mouthwashes. Then you won't have any problem. And about chewing gum, some people say it's increasing the saliva secretion, and saliva has an important effect on cleaning your teeth and curing your gum. So some say it's helpful.
What are your recommendations for healthy and beautiful teeth?
Okay, actually it's not that hard. You should brush your teeth, but brush effectively. 2 times a day, 2 minutes, every surface of the teeth should be brushed. So you should floss, and you should do mouthwashes, and that's all.
Really? That's all?
That's that easy.
I want to play a game. I will say a word and you will continue with a word which comes to your mind. But
Okay.
it needs to have a relation between those words, okay?
Okay.
Okay, I'm
Try.
starting.
Come on.
So, tooth fairy.
Me.
Dentist.
Teeth.
Failed.
Treating.
Teeth whitening.
Hydrogen peroxide.
X-ray.
Tomography.
Crown.
Laminate.
Implant.
Incision.
Plaque.
Biofilm.
Tooth decay.
Bad.
Hygiene.
Good.
Amalgam fillings.
Composite.
Nora.
Pain.
Luna.
Love.
She loves
Why
me.
am I paying?
She loves me, not
I
you.
love you too.
Okay. Thank you for joining us today.
Of course.
It was a great conversation with you.
Yeah, it
Thank
was a
you
lot of fun.
Thank you for the important informations about the dental treatment, and thank you for sharing your experiences with us.
Of course, anytime.
Will we see you again?
If you want, yes.
Yes, we want.
Yes, definitely.
Okay then.
Okay, bye.
See you soon.
See you.